proven heart disease or they have had a stroke, the key for them is to lower the LDL, what people call the bad cholesterol. And so the medicine with the best data for reducing LDL, but also for preventing patients from having more heart attacks and more strokes, is a group of medicine called statin.
Okay, Pipin, there are so many cholesterol medicine in the market.
Yeah.
How do you choose which one is the most suitable cholesterol medicine for your patient?
Depends on what the patient condition is. So for patients who have already proven heart disease or they have had a stroke, the key for them is to lower the LDL, what people call the bad cholesterol. And so the medicine with the best data for reducing LDL, but also for preventing patients from having more heart attacks and more strokes, is a group of medicine called statin. So people would have known about them. The common name for them is like Lipitor, Crestor. Those are examples of statins. And they have been around for many, many years, and they're relatively cheap. So that's the most commonly used group of medicine. More recently, there are medicines to lower LDL that are even more powerful than statin, but they all involve an injection. The injections are every 2 weeks, some of them as infrequent as every 6 months. Now, these injections are more expensive, much more expensive than statin, but they also work better to lower LDL. So they're even stronger than statins. And now the data is coming through that they also protect our patients from heart attack and from further strokes.
About statin, there are so many statins in the market, right?
Yes.
So are they all the same, or some good at something, some are better, some got worse side effect or something? Can you explain? There are so many cholesterol medicine, but are they the same or different?
Over the last 20, 25 years. So of course, when the earlier statins are people know pravastatin, simvastatin. The earlier statin was not so strong at lowering LDL. And then after that, became a bit stronger, it became atorvastatin like Lipitor. Yep. And when Lipitor was about 7-8 years old, a stronger one came out called Crestor, which is called rosuvastatin. Okay, right. So of course the newer the statin, the more the stronger they are. But even new, like Crestor, is already 12 to 15 years old. So new is not very new. They all have the same risk side effect profile. So the risk that we always tell our patients is there's about 1% risk that the patients can feel some muscle tightness or ache in their shoulder, in their thigh. And also when they do a blood test at 3 months after they take a statin, the liver function test, the blood test can be a little bit abnormal for about 1% of patients. Now, these side effects will disappear once the patient stops the statin. So if you stop the statin, all the muscle aches or the liver test, they will all go back to normal.
Okay. So does it mean that you always prescribe the latest, like Crestor instead of Lipitor, instead of simvastatin to lower the cholesterol?
So it depends on a few things. One, it depends on how high the patient's cholesterol is to start. So if your cholesterol, let's say you already start at 300, then it's unlikely that some of the weaker statins will bring your cholesterol down enough. Okay. If your cholesterol is not so bad, then maybe taking a weaker statin will do. The side effect profile between the weaker statin and the stronger statin don't seem to be much different. So you're not getting less side effect because you choose a weaker statin. The side effect profile is about the same. Okay. So really most of the time we choose based on how high the patient's cholesterol is and where is the target, where do we want the cholesterol to be after the patient has been taking the statin.
Is the muscle ache very bad or self-limiting?
The muscle ache is not very bad, but it's annoying. So patients always say that when they try to lift their shoulder up or if they try to stand up from the chair, they feel like they've been to the gym. There's a bit of an achiness in those areas. But they can still walk and they can still work, but they can feel an ache. And then once they stop the statin and it's due to the statin, the muscle ache will disappear.
So if a patient on statin have muscle ache as a complication, if they keep taking statin, the muscle ache will not go away until they stop the medication, right?
Correct, that's right. So in fact, it's a kind of myositis. So it's an inflammation of the muscle.
What about deranged liver function? If somebody on statin, follow-up blood test show deranged liver function, if they continue statin, will the liver function continue to derange or can it improve?
So most of the time it goes up and it stays at a certain level if it becomes abnormal. Now, remember 99% of patients, the liver function is completely normal even taking a statin. Now, and it is now shown that if your liver function test doesn't go more than 2 times of normal limit, so let's say your AST is supposed to be below 30 something and it goes to about 50, 60 something, it is still okay to continue. The liver is not damaged by it, right? But some patients, the liver function goes up manyfold, more than 2, 3, 4 times, then it is probably safer to switch to a different kind of medication.
And the side effect only affects 1% of people who are on statin, right?
Correct, that's right.
Okay. Thanks, Pipin, for your...
Hey, Tony, thank you for your welcoming me on your channel. Thank you.
No problem. If there is any questions, please feel free
I'll try to fill in. Yeah.
Ask in the comment section below.
Yes.
And thank you so much for your time, for listening to us. And I hope to see you again in the next Bincang-Bincang. Bye-bye.
Okay, terima kasih. Bye.